Welcome to the Wellness Surge podcast with Dr. Adiola Oke. Each week, we discuss our wellness journey with real people like you and me. We have conversations about food, fitness, mental health, financial wellness, and much more so you can get back to the real you. To make sure that you're up to date with this and other wellness topics, visit wellnesssurge.com. Information presented here is for educational purposes only and is not intended to diagnose or treat any disease. Please do not apply any of the information presented here without first speaking with your primary care provider. Now, let's head on to the show.
Hello, everybody. Welcome to the Wellness Surge podcast. My name is Dr. Adiola Oke, and I'll be your host for today. Today, we have Miss Iman Zamzam with us. Say hello to everybody.
Hi, everybody.
All righty. So Miss Iman Zamzam has a degree in business, and she never thought about working in healthcare at all until year 2011, when she got severely sick for about 6 weeks, and the only treatment that worked for her was Hijama, and it helped reduce her symptoms. She will tell you a little bit more about that in a few minutes. Her brother had been an Hijama practitioner for about 20 years prior to that, and he always encouraged her to do Hijama, but she didn't because she was scared of blood. So he did the Hijama procedure on her in 2011, and she saw the benefits. That encouraged her to earn her Hijama diploma and her license in 2011. She has been practicing since then. She later went into the nursing field and got a bachelor's in nursing from Northern Arizona University in 2018. She currently lives in Phoenix, Arizona with her 2 amazing teenagers and works in a psychiatric urgent care facility in Phoenix, Arizona. Alrighty, it's a pleasure having you here with us today. Thank you for being on the show.
Well, thank you for having me too.
Alrighty, so I've always wondered, we talk about Hijama, cupping. What is Hijama? What is cupping?
Well, some people, they have actually misconcept about hijama when they do dry, because hijama can be dry or wet cupping. The original hijama is the wet cupping, which is we remove the toxin from your body to relieve the stress, to relieve the pain, to help you take all dirty stuff from your body, and you feel light, you feel different. When you do actually dry cupping, they place the cups on your body and just keep it for about 30 to 40 minutes. And that's actually relieve the pain temporarily for about a day or so. When you do the wet cupping actually, it lasts you the minimum of 3 months. It relieves the pain, especially when people, they have arthritis, they have migraine, they have a lot of stress, they have shoulder pain, they have muscle spasms, they have like problem with a regular period, they have back pain, mainly for back pain as well. And all these actually, once you do the procedure, some people, they think that they can do it once a month or every month. I always advise my patients, once you do this procedure, because it's wet cupping, it's not dry. There's a difference between dry and wet. Dry, you can do it every week. You can do it every 3 days. But with wet cupping, because we remove all these toxins from your body, the minimum you have to wait for about 2 to 3 months.
Okay, so what's the difference? Like when you say wet, dry, what is that? What does that mean?
The dry, you don't take out any toxin from your body. The wet, you take all the toxin away. So you suck the blood out. So what we do actually, when we do wet, we place the cups on the area. First, I do assessment on the patient. This is how I do it. I do assessment. Based on the assessment, in my mind, I know where I have to place the cups, where the cups should be. So for example, somebody has diabetes. So I have to put 1 cup on the pancreas to make the pancreas produce more insulin. This is if the patient has type 2 diabetes, not type 1. With type 1, the pancreas is already damaged. So the patient is not going to benefit of that. For patients, they have blood pressure. You need to know where is the pulse for blood pressure. Patients has disc, they have arthritis, so migraine. Wherever I do assessment, once I do the assessment, and then I know in my head where these cups was going to be placed. So I place the cups on the skin, and first I have to clean the skin, make sure, because you need to puncture the skin very lightly, like you barely touch it. We have to be very careful, especially with diabetic people, because they're actually prone to infection. So what I do, I place the cups and then leave it for a minute or so, or 2 minutes, and then I locate the area where I want to do it. And then you just puncture the skin very, very little, like touching the surface of the skin. This is when you start actually sucking the blood out between the under the skin and between the muscles. We don't touch the veins. There's no blood will come from the veins. This is when you see the blood actually start coming, and then the patients right away, sometimes they feel the difference. Sometimes it takes them about 24 hours. Sometimes it takes them 3 days. Some people it take them 1 week. And so far I have been doing this for 9 years. I never seen any, barely like maybe 2-3% people, they didn't have the perfect effect, because some people, they say, oh, I didn't see that much difference. But the majority of over 90% of the people, they always coming back to me continuously every 3 months, because they see the effect of the hijama and how actually it changed their life. And they actually reduce their pain, especially people with the chronic pain. They have been taking a lot of medications, and especially when they have been taking like medication that actually affect their kidney and liver, and they don't want to live all their life on meds. So they need something naturally, and it's safe. So this is because the hijama is safe. The only people actually I would be concerned about, people when they're actually taking blood thinner medication, I would recommend them to stop the medication for 3 days before I see them. And they have to sign another form that they already stopped the medication, because I can't take liability, because they could lead to death. The other actually concern is patients with dialysis. Those patients, I cannot touch them because they're doing dialysis and the kidney is damaged, and it's really very difficult actually to take this blood out from their body. So it's not going to help them, and it's dangerous. So those people I usually don't touch. And the people with pacemaker usually is a little bit risky. So usually the other patients, I don't have any problem. Usually my patients come to me every 3 to 4 months. Some people every 6 months. It's recommended to clean your body at least twice a year. So when you clean your body twice a year, it's the same thing how you clean up your house from dirt to keep your house clean. It's the same concept. When I talk to people, they don't have any health background. I want to talk to them in a language they do understand. So I tell them how you clean up your house is the same thing you clean up your body. And this is why it's recommended by Prophet Muhammad SAW, because it's our sunnah. We believe in that. And now in this actually days, it's proven that it's very effective. And the Chinese, they're not even Muslim. They're already using it years and years and years ago. And they see how effective it is. Here, actually, some people, they ask me, what is the difference between acupuncture and wet cupping? Wet cupping is different than acupuncture. Acupuncture, they do needling. Needling, they get some blood out, but barely. And that's why the procedure doesn't last more than like a week or 2 weeks. And then they have to come back. Well, they make really good money out of that. With me, I don't see my patients till maybe 3 months, 4 months, 6 months. So it depends how long each patient is different. That's why I would tell them. I had an experience I would like to actually share with you, that I had one patient called me 3 years ago. She asked me that she has a nerve damage, and she asked me that that caused her in her neck. It caused her a lot of migraine, and she needs to do the procedure. She asked me that, do you think that will help? I said, well, I don't guarantee anything. Everything is in the hand of Allah. If you want to come and do it and try it, I mean, you don't have to do a surgery, because she was going to do a surgery. I said, this is not going to cost you too much, and then you try it. If you get benefit of it, then you continue to do it. If not, then the surgery will be your last option. So she came to me, I did the procedure on her. I didn't hear from her for like 8 months later. So I thought maybe she did the surgery. So she called me, she said, Iman, oh my God, the migraines start coming right now. I was like, oh, wow. So you didn't have migraine since then for 8 months? She said, yeah, that was amazing. It's like, okay, so she scheduled and she came. So I did recommend her before the bean started. It's recommended to do it for her every 4 months. So now since then, she has been coming to me every 4 months, and she saw the benefit of it.
Okay.
Some people actually, they see the effect right away. Some people, they see the effect in a little later. So everybody is different. And that's why I always tell my patients, everybody is different, and everybody acts to the procedure in a different way. And it's the same thing. For example, when you take medication, maybe even this medication doesn't work for you, but that doesn't work for other people. But with procedure, with this hijama, it does benefit. Even for example, the people, and they think, oh, it didn't help me much, but it does help you with circulation in your body. It does help you to remove this dirty stuff, even if you didn't feel the real effect of it. But it does. For me, I always do it. Because I work in healthcare, I do my procedure every 2 months, especially for my immune system. So when I got COVID, I didn't get sick. from COVID because my immune system was high, was really good because I boosted every 2 months to make it strong. If there's any bacteria or virus that will invade my body, the immune system is strong enough to fight it. And when I got the COVID in July, I didn't get sick. So I stayed home only for 5 days and then went back to work.
Wow.
So
Wow.
everybody is different. That's why when any patients come to me, I have to do the immune system without even asking them if you need it or not. For example, they tell me they have a lot of stress. So I have to know where's the stress point at. So you have to know, that's why it's not only the hijama, you must have anatomy and physiology as well, because you need to know where's your kidney located, where is your lungs located. People with asthma, I have to do full session for the asthma patients. You need to know where's the lungs located, where's the bones where you need to place those cups. So you need to know, for example, people, they tell you, I have a problem, I have fats in my liver. So you need to know where's the liver located. So you need to put those cups in the right place.
Yeah.
So I believe actually nursing helped me a lot with the hijama, the combination together. It did help me a lot. And I feel actually grateful to help people with these procedures. And because I'm the only one licensed to do this procedure here in Arizona.
Wow, you are?
Yeah, so
you have no wonder somebody recommended you to me. Like, whoa, okay. Wow.
Yeah, that's why. And now because I work so many hours at the psychiatric actually urgent center, we're really, really busy because of the stress, because of the depression due to the pandemic. So my son is licensed. My son, he do the men, I do the women. And I do my best actually to satisfy everybody, but usually I take only 1 or 2 days per week off just only to see my patients. Because I usually work Sunday, Monday, Tuesday, Wednesday, and it's really difficult for me to see anybody while I'm working because I work 7 to 7, and there's no way I can see somebody after my shift.
Okay. I wanted you to share your story, right? Because we talked about you being sick, right? And for about 6 weeks, which then introduced you to Hijama so that people can get a little understanding, right? We got the whole lady about the neck one, but I wanted you to share your story about you talked about like some bleeding and stuff. So just a little briefly, just while the time permits us, okay?
Sure. Well, actually, because I had the bleeding, I didn't know why, what happened. And so I saw multiple doctors and they said they want to remove my uterus. They want to just tighten my tube. So I was like, concerning, you need to tell me what's going on with me. They couldn't. So I said, I refuse to do the surgery. So my hormone blood was really high. So my brother, I contacted him. I said, I'm not feeling good. I'm going to be admitted to the hospital. I had 2 little kids and I didn't know who's going to take care of them. So I was afraid I'm going to die. So I had to bring my mom and my brother, when he heard about my situation, he got his ticket right away in the same week and he came to the United States. When he came, the first thing he did on me, he did the hijama. He did the procedure. At that time, I didn't think about the blood. I am always scared from the blood. I didn't think about anything. I just want to get better. So he did the procedure in me. And then I felt, the minute he finished the procedure, I felt my body back to normal. I felt like it's me again. And I was like, oh, wow, is that? I was amazed. So, and then he told me, see how many years I have been convincing you to. And then actually at that time, he brought all the books because he teach all over the world and he has his own institution in UK. So I was like, okay. And then he brought all the books and I start studying little by little, but I was like, I don't know if I feel comfortable dealing with the blood. At the beginning, it was very difficult for me. And then what happened, I went to my doctor after 1 week because every week they have to check. I became anemic and I was in very critical condition. So he did actually some herbs for me, mix of juice of beets and carrots, all kind of stuff. So to actually compensate me with the blood because so my hemoglobin go high. So when I went to my doctor after 1 week after I did the procedure, I had still blood. It's not bleeding, it's just lining. So when I did the blood work, my doctor told me, have you changed your medication? I said, no. She said, oh, wow, it's strange. I said, what's strange? She said, because I see everything back to normal. I said, well, I know it's back to normal. How do you know? I said, I did hijama and I have been treated with herbs medication. She said, oh, wow, if that works, that's really good. So I was like, yeah, this is the only one helped me and I believe in that. So that's actually what encouraged me to rethink about hijama. I said, when my brother, he was telling me, see how I helped you and how you felt better and how you stopped the bleeding and you feel like you back to normal, and you can help other people, because nobody usually do this, especially in the United States. And
I've seen some athletes. I think I read about athletes. I remember a swimmer that he did hijama. Do you remember? Do you know that? Michael Phelps? Was it Michael Phelps? Have you ever heard about athletes doing it?
yeah,
Hijama to
but I
boost.
don't know who did it. Yeah, I don't know who did it for them, but it was in different state.
Yeah, definitely. Yeah.
Texas, I know in Texas there's a multiple practitioner practice over there. My brother, he went there and he was doing some additional training for those people. And but in Arizona, actually, I'm the only one licensed to do it. And that,
Wow.
usually when people they call me, they contact me. I was like, when I have time, usually I don't take walk-in, so they have to book an appointment, because I'm not
Wow.
available all the time. So it depends on my times off, or I'm not home. For example, I want to go shopping, or there's a lot of things, life is busy. So
Yeah.
I don't accept walking. I do home visit only in severe conditions. When I had a patient like 2 weeks ago, she couldn't move out from her bed. She has sciatic nerve, very, very, very bad. And it does help a lot with the sciatic nerve. So I went to her home and did home visit, but I charge her differently, because I have to drive all the way. Like I drove almost 1 hour.
Wow.
And usually I prefer patients to come to me. I don't like to go to people's house, but I only do it in a severe condition. That's
Okay.
the only way I do it.
Very good. All right, but so some people think about, oh well, how you're licensed, but some people say they do hijama. What are the red flags, right? Like for people where you're like, okay, I'm looking for a hijama practitioner. I'm not in Arizona. I cannot contact you. Who else should I feel confident contacting? Is there like an hijama buddy that we should go and look for people, kind of thing, so we can know like people that are
Well,
certified?
they need actually to learn about the practitioner background, because
Mm-hmm.
one guy actually he wants to learn hijama, and he did only the course for 1 week. That's not enough, and he doesn't have any background about health, nothing. And when he started doing hijama, he was doing deep cut. This is dangerous and extremely dangerous. My brother told him, you have to stop. This is can take you to jail, because some people can sue you. You're not eligible to actually practice. Some people, they say they came from Africa. I know one lady that she came from Africa and from Sudan, and she was doing the procedure without license. And I asked her, when I called her, I had back pain at that time. My son wasn't licensed at that time. So I told her I might have my back pain. Usually my brother actually comes and do it for me, and he didn't come for almost a year, and I need to do it. I heard you do it. I asked her, do you have license? She said, no. I said, how did you learn it? She said, I learned it from back home, from my grandma. That's not how you practice. And yeah, it's not safe practice, because you don't know. For example, if somebody, faint, you're doing the procedure, you don't know why the patients faint, because the patient can faint for 3 reasons. They lose actually oxygen in the brain, they're very scared, or they're anemic. So how you can get the patients out and back to normal? You have to learn about all of that. And if even she's not licensed to do CPR, what about if the patients died in your care? So to
Sure.
be licensed, you need to know what you're doing, what are you doing, and plus the red flag you're talking about, the hygiene.
Yes.
So they're doing terribly job in hygiene, because this is something, it's very important. I care so much about it. And because you cannot transmit the disease from one person to another. This is really dangerous. And everything I use for hijama procedure, if it's only one time use for that patient, I throw everything away. And that lady, she told me she washed the cups. I said, what? So that's crazy. I said, you can't do that. She said, yeah, because the cups is expensive. Well, you're causing disease to other people. I told her, did you study microbiology? Did you know how the bacteria grow? And no, she doesn't understand, because this is the blood you're dealing with. I told her, let me ask you this question. When you go to the doctor, they give you a shot. There is little tiny blood comes from that needle. They wash it and clean it and use it for other people. She looked at me like that. I said, excuse me, because they put it in the sharp. This is how dangerous to deal with blood. You cannot wash it. You cannot reuse it. You cannot, this is everything you have. And this is a big flag. That's why when people, they saw her, what she's doing, they stopped going there.
Okay, good. Thank you. That's what I wanted because I was reading about hijama and stuff. I was like, oh, how do you know who to contact and all that? All righty, so we've kind of talked about a lot and I benefited. So what I'm going to recap is this. It seems like hijama is just good for your immune system. And during this COVID, we all need that, right? Hijama is good for pain, people with chronic pain, for stress relief. It's good for cleaning out, like depression.
Yep.
Oh, depression. Okay. All right, good to know. Depression. Alrighty, is good for pain. What else did you say?
Migraine,
Migraine.
arthritis,
Okay, I think I read about migraine, and
irregular
I think I read
period.
about vertigo. I read about vertigo, like people
And
that are like,
let me, vertigo is very effective. Yeah, I did many actually people. The thing actually you will be amazed with, I did actually, there are a couple, 3 years, about less than 3 years ago, from Turkey. They came to me to do procedure. He's a teacher and his wife is a teacher too. So they have been married for 8 years. So what happened, I told them, he said he came just mainly to do the procedure on his back because his back is hurting. I was like, okay, fine. Then his wife mentioned to me, because I didn't know, she said, I have been married for 8 years. I didn't have children. I said, you don't want children or you want children? She said, yeah, of course I want children, but we're not able to proceed children. I was like, okay, conceive children. I was like, okay, would you like me to do the hormone for the child to have for fertility? She said, yeah, if you can. I mean, I will be blessed. I was like, okay. So I did both of them, and I did the hormonal one for fertility. And then I didn't hear from them for 1 year. So after 1 year, they called me to do the procedure again. And they came to me and they had a little girl. She's 6 months.
what?
And then I was like, I don't, you didn't tell me you get pregnant. She said, I get pregnant like right after you did the hijama for me, after like maybe 6 weeks. I said, how come you didn't tell me you get pregnant? She said, I didn't believe it. I was like, I thought like they're lying to me. I'm not, even when I get, my tummy was getting bigger. I was like, oh my God, I'm really pregnant. And then I had to bring my mom. I stopped working. I just want to keep the baby. She was so excited. And then I was like, oh my goodness, when I hold the baby, I was like, oh my God. So she was like amazed. She said, that's why I always tell all my friends, please, if you have any issue, you have any fertility problem, irregular period, you have arthritis, you have rheumatitis, you have like any kind of disease, just go, she will help you. And that's why so many Turkish people, they come to me, they always ask me, Iman, we heard so many good things about you.
Wow.
How you
Wow.
proceed the procedure, because about the hygienic, because you are very careful, very safe. And
Yeah. The person that recommended you to me, he was just telling me about health stuff, and he's like, "Oh, you need to talk to this lady." I'm like, "Okay, I'll call her." And so that was, you didn't even tell him. You must be so good that he just recommended you from the blue. And this last piece you just gave me, you just blew me. You just blew me away. Alrighty. So this is gold. All right. So we've talked a lot today. What is one thing that you want to make sure that people get from this conversation about hijama?
well, I want them actually to go back years and years, 1400 years ago, how these people used to get treated and get actually relief. And some people, they scared, I understand, from the blood. And that's why I wanted to assure everybody, this is not really painful procedure. It's just uncomfortable. There is difference between painful and uncomfortable. That's why when somebody come to me, they don't want to do it. They really want to do it, but they said, oh my God, I'm scared from blood. I'm scared from the puncture. You're going to penetrate my skin. And I was like, I tell them it's the same thing. Like when the cat scratch you, you feel the same thing. It's uncomfortable. When people actually is very sensitive, I usually do numbing cream. I numb them for 45 minutes before I do the procedure on them. But I mean, on myself, to be honest with you, I don't numb myself anymore because my body is used to the hijama, so I don't usually do it. So I wanted to tell them how effective it is, how to get benefit of it, and you are not going to feel the effect of it until you do it. Once you do it, you can see the difference. You know what I mean? Because some people, when you tell them about your experience, you're not going to feel the same until you do it yourself. Because what happened, I remember one actually customer came to me and he was afraid. His teenager came with his mom and he was shaky and it was like, oh my God, I looked it on the YouTube. I see how much blood you can get out and blah, blah. It looks painful. I told him, you know what I mean? Just lay down and we'll do only 1 pound for you. If you feel uncomfortable, you feel you cannot do it, I'll stop. I'm not going to complete 1 session for you. He said, okay. So he agreed. So I did only 1 pound. I said, how is it? He said, yeah, I can handle that. I was like, okay, so we can continue. So you need to assure the people that the procedure is safe and it's not dangerous like some people, when they see the blood, like, oh my goodness, it is safe, but you need to know which practitioner you want to see. You need to look for background. You need to see how long people they have been doing this. You want to make sure that the hygiene it's number one. You need to make sure that the cups is not used. You have to make sure every patient is going to be only 1 time, because this is patient's care. I mean, this is patient's care and patients in your hand. You have to be honest. You know what I mean? You have to do this procedure with honesty, with love, with like, you have to do your best. When I care for my patients at my facility, I always give them the same attention for everyone. I'm not going to take care of take care of one person more than the other. No, I care about my patients all the same. I treat my patients all the same. I don't have a problem with that. Some patients come to me, they have bulimia. I tell them, I educate them. I educate my patients about the procedure before and after. I tell them you cannot eat before you come to do the procedure for at least 2 hours, because once you eat too much and you come to me, you will be nauseated, you may throw up. So you have not to eat. After you do the procedure, you cannot take a shower for 24 hours. The first 2 showers it's going to be warm water. Don't use scrubs, okay? Don't eat red meat for 24 hours. You can eat fish, you can eat chicken, you can eat vegetables, rice, whatever you want. So I do usually educate it. I tell them it might be itchy, a little bit itchy when you do the procedure for a day or so. I have usually cream samples I can give them. They can use it, and that's it. It's only for like a day or so, and it will go away. Usually the marks, it will go away it takes about maybe a week to go away. The one in the face, maybe it takes about 10 days because it's more sensitive. So usually I educate them because I want them to expect these things. I don't want them to call me back. They say, oh, the marks is still there. How long it's going to take? So when you give them all the education, they already have an idea. So they don't have to bother you and call you again to have the knowledge about it.
Very good. All right. So how can people get a hold of you after the show? So if they want to come and get some hijama, right? Even out of state, people, I'm sure they want to fly out, come and meet you.
Yeah, of course. When I started, actually, I'm planning, because what happened, I was planning in March to open my own clinic. Mm-hmm. This is when the pandemic hit, and I was really busy with my work. So I waited. I'm waiting actually to maybe at the end of this year or the beginning of next year, inshallah, I'm going to actually buy a place and open a clinic. And then I'm going to do the advertisement. Usually I post some on my website on the Facebook. They can actually look me on the Facebook, but it's not, I didn't have a special.
Okay, so what's your Facebook?
No, I don't have, I list usually only the brochure under my name, but I'm going to open like special just advertisement on the Facebook once I open the clinic. So I can put the right address for the clinic and everything. And I'm going to make more advertisement because not many people know about it. Because when you educate people about it, they know what it is, they feel safe, they feel comfortable to come. Some people, they don't know, they have lack of knowledge. That's why they're scared, they don't want to do it. Because if you educate people about it, they will feel more comfortable. When they come to me, they're scared. Once I educate them, they feel comfortable and they actually calm down. So that's why I'm telling you, many, many people, especially American people, they don't know. I do have some American people come, some Mexican, but the majority are Muslim. The one who comes.
Okay, so I just want to make sure we understand how to find you on Facebook. Your name, Iman, I-M-A-N, and then last name, Zamzam. Zamzam, yes. Like it's spelled. So that's how they can find you.
My first name started actually in the Facebook is Zamzam and then Iman.
Okay, so on Facebook they can find you as Zamzam Iman. Okay, all right, yes. That's what we want to get. So thank you so much. Thank you so much. This has been enlightening, and I will be making my appointment very soon.
You're welcome.
All righty. So guys, it has been wonderful hanging with you. I hope you learned a thing or two, a couple, from this episode, learning about hijama and cupping, which is the same as cupping, but she does wet cupping. All right. But if you like the show, make sure you subscribe. All right, and to our channel so you don't miss an episode. All right. You have a wonderful week now. Bye-bye.
Thank you so much. Thank you.
Bye.
Thank you for listening and sharing your precious time with us. If you enjoyed the show, then follow us and subscribe on iTunes, YouTube, or any app that carries podcasts. Have an awesome week. Best wishes to see you thrive.